Good afternoon, everyone. Thanks for joining me today. We'll start with an update. We have 4 new cases of COVID-19 in our province today. 2 of these are in Eastern Health Region, both female and both less than 20 years of age. One is travel-related and not linked to the cluster announced yesterday. One is a close contact to a case in the cluster announced yesterday. 2 of the cases are in Central Health. Both are male. One is between the age of 40 and 49 and is travel-related. The other individual is between the age of 20 and 39 and is associated with the Marine Atlantic situation. There have been no new recoveries in the province, leaving 13 active cases and a total case count of 408. 1 person is hospitalized, and in total we have tested 79,289 people. We have identified a new case associated with the Marine Atlantic vessel, and this is not unexpected. We have had discussions with public health officials in Nova Scotia and with Marine Atlantic. The investigation is ongoing, and we will update when we have more information to share. If you have travelled on the MV Blue Patties between December 29th and January 16th, we do still ask that you contact 811 for testing if you have not already done so, even if you are not symptomatic. In total, we now have 5 cases associated with the cluster announced yesterday. Eastern Health is still in the process of investigating the initial source, and we still have a suspect case associated with a daycare, but that has not yet been confirmed as a positive case. Eastern Health is also contacting anyone that is a close contact of these cases, and we now have approximately 160 individuals who have been contacted by public health and are in self-isolation as a result of being identified as a contact of individuals in this cluster. If everyone had the COVID alert app, this would make the load much lighter for public health. Contact tracing alone can quickly overwhelm public health resources with such high numbers of contacts. Please, if you do not have the app, I strongly encourage you to download it so that you can be alerted if you are a close contact of a COVID case. This will go a long way in helping us to do our job. The situation really speaks to the importance of keeping your close contacts to 20 or less. And by close contacts, we mean how often you interact with them, the setting you interact with them, how close in proximity you interact with them, and how long in duration the close interaction is defined, once again, by people, space, time, and place. Where we find ourselves in places with people who are not our close contact, we need to minimize interactions in terms of proximity, duration, and common touch points. As an example, if you play sports, do not share water bottles or food. Change rooms should not be used for social gatherings. Get changed in your designated space while wearing a mask at least 6 feet apart from others, and leave the premises when you are done. If you are at work and are unable to distance from your coworkers or clients, ensure you wear a properly fitted non-medical mask and wash your hands before and after interacting. Keep your interactions as short as they need to be. And if you can physically distance from your coworkers or clients, please do so. Because we have done such a good job in flattening the curve for so long, it's easy to feel more relaxed about our interactions with others. We cannot make this mistake. We cannot become complacent. And while I realize that we're still in a much better position than other places in Canada, we work tirelessly to contain the spread of COVID so that we don't find ourselves in the same situation. We need everyone to help keep COVID at bay. This is a team effort between federal and provincial governments, public health, border officials, municipalities, and businesses. But public health lives in the community. The precautions that each of you take as you go about your day-to-day activities are critical in supporting our efforts to identify and contain the virus. We've been here before. We have stared down the face of COVID, and we can do it again. So let's strengthen our defenses and hold fast, Newfoundland and Labrador. Thank you. And I'll now turn it over, Leslie, to you for questions.
Thank you, Dr. Fitzgerald. There are 6 reporters registered for today's call. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Mark Quinn with CBC. Please go ahead.
Good morning, and thank you. CBC spoke with a business owner whose employee lives with someone who tested positive. And when we spoke with the business owner, they said that they had difficulty finding information. They said they went to the website, but they had trouble finding a single source for information about what to do and how to proceed. I wonder if you could comment on that.
So certainly if public health felt at the time that there was a concern with the business itself, they would certainly have been advised by public health. So if they felt there was any need to do that, contacts had to be isolating or anything like that, they certainly would have advised that business in that regard. With respect to what to do in this situation, certainly all the same advice that we've been giving all along. Make sure you're cleaning well, that you're frequently cleaning those high-touch surfaces, allowing employees, making it easy for employees to be able to stay home if they're feeling unwell, screening employees when they come in, having your hand sanitizer out for any clients or customers that may walk in the door. All of those things are very important at reducing the risk.
Thank you. And as a follow-up, there are many rumors flying around, and I won't ask you a rumor-based question, but because of all these rumors, people aren't certain what to believe and what not. And I think some people are questioning if it's more harmful to protect privacy than perhaps be more transparent. And I guess there's a fine line, but is it possible to be too careful about protecting privacy and encouraging rumors and doing more damage that way than being completely open and naming places so people can know what's going on?
So, as we have done in the past, and we will do, if we feel that there is a need from a public protection, public safety point of view to announce the location of a place where we feel if people have been that they need to be tested, we will certainly do that. We are constantly trying to balance privacy with public health and safety. There are situations where we have to be especially cognizant of that. So right now, if at the moment our investigation hasn't brought us to a place where we feel we need to make those kinds of declarations, that we've been able to identify contacts in certain situations and contact them directly. So anybody who might be at risk would be contacted directly. But as we have done with our flight advisories, and we have done with other advisories in the past, with regard to retail places and things like that, we will make the announcement if it is necessary.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. I wanted to follow up on Mark's question. Clearly, you don't encourage rumors. Can you explain what your criteria would be for alerting people if, for example, a certain business or a public place might have been the source of contact? What is your criteria for determining that?
So first of all, you would have to make a distinction, was the person considered infectious when they were in that particular place? So if somebody was in a place 5 days before they became symptomatic, they weren't infectious, and so that's not at risk. So that's the first thing you have to determine. And then when you decide if a person was in a public place when they were infectious, then you look at what they did there. How close were their contacts there? Were they wearing a mask? How long were they in the place? And that helps you to determine the risk to the public in that particular place. And so if that risk is low, then there's not a danger to public safety and you don't need to announce. If you feel that the risk is significant enough that you need to announce it, then you do. But it's individual, I guess, for each situation. You have to make that risk assessment based on the information that you get from the case.
Okay, and as a follow-up, I'd actually like to switch gears. The Prime Minister is supposed to be concurrently announcing new border measures. Has the province been informed of any of these, such as the possibility of having international travelers quarantine in hotels?
So I can't speak to that right off the top right now. I believe some of those that announcement may be ongoing as we speak right now. So, the details of that I don't really have at this point, Peter. Sorry.
Okay, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Dr. Fitzgerald, you say that the suspect case at the daycare has not yet been confirmed. Why is that, and why is there a delay in determining if that person is in fact positive?
So I can't really talk about individual cases and what their test results are and things like that. But a suspect case is a case that is symptomatic and associated, so linked in some way epidemiologically to a confirmed case. Then suspect cases are tested, and then depending on the test result, if they're a positive test result, then they become a confirmed case themselves, and if they're a negative test result, they're still a suspect case. But the way that we treat a suspect case doesn't change with their test result. We still are watching their contacts closely. We still will test those contacts.
Okay, and in terms of the new case associated with the MV Blue Patisse, that vessel had returned to service, as I understand it, since it was initially taken out of service because of the initial cases. Had this person been working since the reopening of that vessel, and what do you advise needs to happen with that vessel if that person was working?
So all the people who came off who were considered at risk were in isolation. So this person was in isolation, so he wasn't on the vessel.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. I'm wondering, in terms of contact tracing, how deep that goes. Is it contacts of contacts? Say, for example, my friend was near a COVID positive, has been deemed a contact, is self-isolating. Do I then need to as well self-isolate?
No. So self-isolation happens for people who are returning from, areas with higher incidence, so travelers returning to the province. And it happens, so quarantine, really, I guess we call it self-isolation, but quarantine are well people, so they don't have symptoms, and but they're considered to be higher risk. So those would be people who are traveling back to the province from elsewhere, and they would be contacts of cases. So if you have a positive case and you do the contact tracing, then all of their contacts have to quarantine. If those people are unwell, then we call that, if they have symptoms, then we call it isolation. So isolation applies to a sick person, quarantine applies to a well person. It's the contacts of cases generally that will have to quarantine. Now, if you were in a situation where you had to have a child quarantine, then obviously a child can't quarantine away from their family, so then a parent would have to quarantine with that child because there is a risk that that child could become a case and then could pass it on to the parent, right? So there are some situations where a contact of a contact may have to isolate, but generally speaking, it's just contacts of cases who have to isolate or quarantine.
Thank you. And as well, with everyone that is self-isolating, I think you mentioned approximately 116 people. Are they all being tested as well, or is it only once they become symptomatic?
No, so everybody's being tested. So we're doing two things here. We're looking to make sure that we don't have onward spread from the people who are now diagnosed, and we're also doing that backwards contact tracing to see if we can find a source. So we have to test people in that situation to see if we can find that source. So it's about 160, actually, 60.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland and Labrador. Please go ahead.
Thank you. With this small spike in non-epi-linked cases, I'm curious, what would it take for us to go back to alert level 3?
So at this point, we've only got one non-epi-linked case, and that was the first case that came out with this cluster, right? So everybody else is epi-linked to to the first case of that cluster. But we do have a cluster, therefore, that's non-epi linked. So we're not, at this point, we are, we're watching things closely. We're trying to see how broad the spread is here. We may be lucky enough that things are contained fairly closely. So if that's the case, that's great. And we won't have to look at further lockdown measures. But if we start to see that there is spread of this beyond, this small cluster right now, if we start to see more cases in the community, if some of these contacts end up showing being positive, then we may have to consider some additional measures. But we're still looking at the evidence right now and trying to decide or trying to evaluate that. So at the moment, we're not there with regard to increasing measures, but it's always something we're looking at.
Thank you. And I was hoping for clarification, something mentioned earlier on Wednesday or yesterday. You mentioned the first case might link back to New Year's, and I was hoping clarification on that. Do you mean like New Year's Day, New Year's Eve, the New Year's celebration period?
Yeah, so we've gone back as far as New Year's Eve for source tracing, and so that's approximately 2 weeks prior to the onset of symptoms in the first case.
Perfect, thanks.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. I'm wondering if our vaccinators, if they can reliably get 6 doses out of the Pfizer vials.
So that's certainly something that we've asked vaccinators to try to get the 6 doses out of the vial. And I think, as with many other jurisdictions in the country, it's not something that's we can say is 100%. We're probably getting the 6 doses 50 to 60% of the time.
Okay. Do we have any issues with needle supply or anything like that?
At the moment, we don't. No.
Okay. Thank you so much.
Excuse me.
I will now go back through each reporter to see if you have one final question. Mark Quinn with CBC, do you have a final question?
Yes, I do. I wonder if you could, for my purposes, just clarify which case you don't know the source of. I think it's my understanding that there's a case that you've identified a while back, and some of the people in the cluster are traced back to that person, but you haven't identified the source for that person. Is that correct?
Right. So there's a couple of different things here. So we have our index case, which is the first case that presented to us, but then there's what we see as chronologically being the first case as well, like the first person to become unwell. So there's the link that we can't ascertain is how that person got sick. The other people, we feel like we have made those connections. So the non-epi link applies to that first case. And then when we have a cluster, generally speaking, all of the other cases come from, 1 or 2 cases. So you have an initial, in our case, for the most part, it's going to be a traveler who comes in, and then that traveler gives it to 1 or 2 people, and then those 1 or 2 people will pass it on as well. So, but once we, if we're able to get back and find the source, then we'll be able to say that this is, we'll be able to determine what that epidemiological link was, right? So for right now, it's just that first case that becomes sick.
And when was that person identified as positive?
So I don't have those details, Mark. I'm sorry.
Peter Jackson with the Telegram, do you have a final question?
Yes, I'd like to follow up on Sarah's question about the 6-dose thing. There is a specific type of needle, apparently, that's needed to get those 6 doses out of the vial. And there are reports they may be in short supply. So if Pfizer does actually reduce its supply based on that principle, is that going to be a problem?
So certainly those discussions are happening right now. And, we have advised as to our concerns about that. So, we'll have to let you know, I guess, what happens with that. But ultimately, that decision does not lie with us.
Okay, thank you.
Richard Duggan with VOCN. Do you have a final question?
Yes, we're hearing of 4 confirmed cases in Fairmont, Quebec. Do you think that the Labrador border should be closed or other restrictions put in place there?
So my understanding with regard to cases in Quebec, certainly we're in contact with public health officials in Quebec, and when they have cases that are of concern in that area, they do notify us. So that connection has been quite good, and generally speaking, these are people who are not, they tend to be coming in to work, and so they're not generally in the communities themselves, but in some of the companies around the community. And so they're screened, and the risk is low to the community in general. And so the risk, with regard to the border is low as well.
Thank you.
Kellyanne Roberts with NTV. Do you have a final question?
I do. Other than the first unknown source case, all the cases from that since have been able to be linked. So in terms of community transmission, it's not from being in the same grocery store or restaurant as someone. These are all either household or work contacts still at this point?
Yeah, so they're close contacts with each other, yes. So yeah,
Thank
nobody has gone in that regard, no, in what you've described, no.
Thank you.
Elizabeth Witten with All Newfoundland and Labrador. Do you have a final question?
Yes. With Memorial University, they announced some weeks ago that they intend to have all their staff, or most of their staff, go back to campus on Monday. And you previously said, you don't work for MUN, you're not making the decisions for MUN. But would you still recommend that they have staff go back to campus come Monday?
So our recommendations from a public health point of view with regard to working from home have been pretty clear from the start. So I think I'll just refer you back to that. And again, you know how an institution or a company or a private company wants to conduct their business, they have to look at our guidance and determine if they are able to do it safely and take the appropriate precautions to protect their employees.
Thank you.
Sarah Smelly with the Canadian Press. Do you have a final question?
Yes, I'm just wondering, the last time we had a non-epidemiologically linked case in Harbour Breton, you described it as someone perhaps having been sick and not being aware that they were sick, or someone having been sick and then left the province. Is that still an accurate description for what might possibly be going on here?
Yeah, I mean, there could be an asymptomatic carrier, somebody who's had no symptoms at all and didn't realize that they were infectious. It could be somebody who had mild symptoms and didn't get tested because they didn't think it was anything they needed to worry about. But, as we said many times, COVID can actually be very mild, a very mild disease in some people, but, they pass that infection on to someone else and it can become a very severe disease in someone else. So you do have to be careful, and even if you have mild symptoms, then we would suggest that you get assessed to see if you need to get tested. Then it could be somebody who was here, who was sick, who has since left. That's always a possibility. So,
thank you.
Thank you, everyone. Dr. Fitzgerald, do you have any final comments today?
Thanks, Leslie. Just everybody take care, stay safe, try to be sure to follow the public health measures to keep yourselves and your loved ones as safe as possible, and take care. Have a good weekend.
Thank you, Dr. Fitzgerald. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.